Hello, this is Kim Jong-il. Today, in part 2 of the treatment of palatal displacement of maxillary lateral incisor, we will discuss tooth alignment and torque control. In case of palatal displacement, the most important thing is creating space and then tooth alignment. Occlusal force is removed first, teeth are aligned, and torque is controlled. When creating space, open coil spring is mainly used. In case of premolar extraction, space is created by moving the canine posteriorly by using an open coil spring in the upper lateral incisor area. In non-extraction cases, the brackets are attached to the upper central incisors, canines, second premolars, and second molars. And open coil spring is used in the lateral incisor area to create space for the lateral incisor to move labially. At this time, do not attach the bracket to the adjacent first premolars. The anterior teeth move slightly anteriorly, and the canines move posteriorly. The anterior teeth move slightly anteriorly, and the canines move posteriorly. Since the first premolar is not bonded, it may move palatally. The most important thing in non-extraction treatment is to create space while minimizing labioversion of the upper incisors. It is difficult to attach the bracket in correct position on the palatally displaced lateral incisor. Therefore, first attach the lingual button or mini-size bracket, and then attach the SWA bracket upside down when the tooth moves into the arch. When aligning the lateral incisors, many orthodontists use super-elastic arch wire. As the lateral incisor moves labially, the adjacent teeth are rotated as in the picture. To compensate for this, use an open coil spring on the main arch wire as shown in C. In this way, the arch form can be maintained, and the rotational force on the adjacent teeth is counterbalanced, so that the palatally displaced lateral incisor can be moved into its proper position easily. The palatally displaced lateral incisor should be decrowded. For crowding of more than 4 mm, orthodontic traction should be performed first. For crowding of 2-4 mm, it is better to use tie overlay, even on the rotated teeth. For crowding of less than 2 mm, main niti arch wire can be directly ligated. The arch wire used to create space is 016 SS. On 016 SS wire, use open coil spring in the lateral incisor area and tight cinch back. The length of open coil spring should be a bracket width longer than the interbracket distance. After space is created, attach the bracket to the lateral incisor. If it is impossible to bond the bracket in the correct position, attach a lingual button first and then pull it. If the device can be attached in the correct position, attach the SWA bracket upside down. Normally, when attaching an SWA bracket normally, the marking point is located distogingivally. But when it is attached upside down, the marking point is located mesio-occlusally or mesio-incisally. Then the lateral incisor pulled. After it is somewhat moved, use niti overlay while maintaining 016 SS main arch wire with open coil spring. When the amount of crowding is less than 2 mm, change the main arch wire to 014 niti arch wire and directly ligate the lateral incisor. Then, use torque control arch wire 001 Sano Mex22 SS with L loops in front of and behind the lateral incisor to induce root labial movement. When the lateral incisor is aligned, usually only the crown moves labially and the root stays palatally. So root labial movement is needed. In other words, palatally displaced teeth are unaesthetic when they are first aligned. Therefore, it should not be finished just because the teeth are aligned. Then when is torque control arch wire necessary? First, when clinical crown length is short after alignment. Because only the crown moves labially, the clinical crown length is short when viewed from the front. Second is when there is an unsmooth palatal gingival margin on the palatal side. The SWA upper lateral incisor bracket is programmed with plus 8 degrees of crown labial torque. The marking point is located at the distogingival area. If it is attached upside down, the location of the marking point changes to mesio-incisal area, and the torque changes to minus 8 degrees root labial torque. There are two methods for root labial movement. Picture A shows the use of torquing spring on continuous arch wire. Theoretically, when a torquing spring is used, the crown moves palatally and the root moves labially. However, is it possible for the lateral incisor to move independently on continuous arch wire? This is not desirable. As in picture B, individual tooth movement is required. In order to move the lateral incisor independently, L loops are inserted in front of and behind. This is called torque control arch wire, minus 7 degrees root labial. Torque is applied to the lateral incisor. Therefore, for root labial movement, SWA bracket is attached upside down, and torque control arch wire is used. It is advisable to use this torque control arch wire for at least 6 months. Because while mesiodistal tooth movement is easy, buccolingual movement, especially root labial movement, takes a long time. Use of this wire during finishing lengthens the treatment period, so it has to be considered from when the bracket is attached. This is an extraction case. In extraction cases, SWA brackets which are programmed with torque are used for the upper 4 incisors. Space for the upper lateral incisor is created, and it is aligned. During space closure, the canine is first moved posteriorly. Space between the upper 4 incisors is closed by the use of power chain, and then the rest of the extraction space is closed. For non-extraction cases, I recommend the use of Kim's bracket 0 degree and SWA. After strategic bonding, the use of open coil spring on ERO 16-022 SS wire with anterior crown lingual torque expands the arch laterally and derotates the terminal molars. When arch wire with crown lingual torque is used with Kim's brackets, crowns move palatally while the roots move labially. The use of open coil spring with SWA brackets only moves the crowns labially. But with Kim's bracket and arch wire with crown lingual torque, the teeth can move bodily. Let's look at the direction of the force. A shows unilateral crowding and B shows for bilateral crowding. In unilateral crowding, the upper incisors move slightly labially, and the teeth move in the direction that improves the midline. But in bilateral crowding, there is a high possibility of labial movement of the upper incisors, which is unaesthetic. So how should the force vector be directed? It is appropriate to resolve crowding on one side first so that bilateral crowding becomes unilateral crowding. The tooth movement pattern is different on each side. In the photo, since it is easier to create space on the left side was aligned first. If the tooth size is small, metal bracket can be used. After aligning the tooth in its correct position, the SWA bracket is attached upside down. In general, SWA bracket has a cap on the incisal side. Since SWA bracket was attached upside down on this tooth, the cap is on the gingival side. -7 degrees torque control arch wire was used on tooth 22, and at the same time, open coil spring was used to create space for tooth 12. So it was possible to simultaneously control the torque of tooth 22 and create space for tooth 12. Then tooth 12 was aligned. When tooth 12 was aligned, the adjacent teeth could become mesially rotated. To minimize this, teeth 11 and 12 were tied with figure of 8 tie. After alignment, in order to control the torque on teeth 12 and 22, MIOBU with additional L loops between the central and lateral incisors was used. Elastics were used to finish, and bonding retainer was used for retention. Here are pre- and post-treatment X-rays. Despite the severe upper anterior crowding, the teeth can be aligned without root resorption through strategic leveling. Let's take a look at the tooth movement. These are the pre- and post-treatment cephalometric X-rays. In the superimposition, the crown of the upper incisor did not move much labially by the treatment. The labial movement of upper incisors could be minimized by using 0-degree Kim's bracket and open coil spring on main arch wire with crown lingual torque. In addition, SWA bracket was attached upside down on the palatally displaced upper lateral incisor. That is, the bracket's dot was directed mesio-incisally when the bracket was attached. For torque control, it is advisable to attach it slightly deeper than the correct position by about 0.5 mm, if possible. Then ZOC1622SS torque control arch wire was used to induce root labial movement. Keep the torque control arch wire for at least 6 months. Palatally displaced teeth are very likely to relapse. Therefore, it is recommended to use bonding retainer between the upper canines and additional wraparound retainer. Let's take a look at the cases of palatally displaced upper lateral incisors. There are cases of severe crowding with no space at all, with a little space, not severe crowding, and mesial rotation. As shown on the right, the severe, the crowding, the higher, the possibility of extraction. Let's think again about the treatment of palatally displaced teeth. First, space has to be created first. After creating space, attach the bracket to the lateral incisor and pull with ligature wire. In some cases, a bracket may be attached to the palatal side as shown in Figure B. At this time, use Niti overlay arch wire while keeping open coil spring on the main arch wire. For Niti overlay, 013 copper. Niti arch wire is mainly used. The palatally displaced tooth will move slowly labially. After the tooth has moved somewhat labially, maintain open coil spring on 016 SS main arch wire. And use Niti overlay arch wire to move the palatally displaced tooth labially. When the crowding is less than 2 mm, change the main arch wire to Niti arch wire and directly ligate the tooth. Then use 016X Z022 SS torque control arch wire on the lateral incisor. Let's review. The most important thing is to create space. After creating space, the teeth are aligned and torque control is performed. When aligning teeth, it is difficult to attach the bracket in correct position on the palatally displaced teeth. In this case, it should be considered whether the occlusal force has to be removed. In case of severe crowding, posterior bite block can be used in the mandible in order to remove occlusal force. Depending on the device, a lingual button can be attached, or a metal bracket can be temporarily attached and replaced with SWA bracket upside down. After alignment, use torque control arch wire on the lateral incisor to finish. Thank you for watching.